First item on the agenda, administrative approval of the minutes.
So I got about halfway through the minutes, and with clinic season, I just decided that I couldn't do it. So what I'm going to do is in the next couple weeks, I'll put them together and I'll send out draft minutes to everybody. So that there's still a record of what happened, but that we will just approve them at the next meeting. I approve.
Hi.
Hi,
All right.
good.
Meeting dates, best practices for hybrid meetings, we should speak.
So if you go on your agenda, flip that over. We've had some towns that the citizen speak has gotten a little rowdy and uncontrolled. And so, you know, through the next year, one of the things that we're going to work on is just helping boards feel supported and have the tools they need to not get overwhelmed by citizen speak. Citizen speak, I think, is really important to our democracy, and it gives a framework. But I just wanted to provide this. The digital form that I sent you, it doesn't have that gray strip on the side, but you might want to consider if you are one of a town that would like to have a policy, you might want to consider using this. This came from Mike Hugo and does have some options that may or may not work for your particular town.
Thank you.
Jane, if I could offer to the group, so I've been dealing with citizen speak time through COVID and other realms for quite some time. And for the Tri-Town boards, I've written policies on how to conduct a public hearing and citizen speak time, whatever. If any board or agent or anyone wants to have like a Zoom call session to kind of talk offline differently, to kind of ask questions, I'd be more than happy to be a facilitator at a meeting of such kind. Because I've been working on this for quite some time, even with town council, on do's and don'ts and what we should and shouldn't be doing, including open meeting law stuff related to citizen speak. So I'm just making that offer. If anyone wants to have a conversation down the road, just to talk or whatever about lessons we've learned and what we know about citizen speak, let me know.
Great.
Moving on to staff updates, public health.
So we have started our clinic season. We've had 6 clinics so far. I did make up this little packet that's broken down so far what we had. We've had great turnout. People have really taken to pre-registering, and yesterday the Claire T Senior Center, everybody was commenting how smooth it was. And so they're like, they started comments about here what a mess it was. So yes, it was great. And this year we're offering 6 months to 4 years and 5 to 11 for state supplied COVID. Had a lot of 5 to 11-year-olds come through, and had a couple of littles getting their first dose, so it's good. So they'll be following up to get their second and third dose with us at some point. Always looking for help. So if Jane sends out an SOS, we'll take help. That would be great.
People came in yesterday saying how organized we were, which is really nice.
Yeah, that's huge. Makes it run smooth. We recently, Jane, Pam and I did a train the trainer for Narcan training up in Pittsfield. When was that? September? So our plan is to, we would like to go to the schools. I don't know if that's a conversation to have at some point to, train staff for Narcan use. It's about a 2-hour training that we would have to provide. Then we do that like on a teacher professional development day, but that's a conversation to have at some point. Maybe restaurant workers.
Yeah.
It's not a discussion that we have around this.
And it'll be interesting to ask the inspectors if they would like to get trained and then supply them with a supply of Narcan just to hand like 1 or 2 out at the restaurants. That's a question to have with inspectors.
So right now we have paused our wellness sessions. We're gonna start back up in January. We are gonna meet with towns and, the councils on aging to see if there's a different date or time and piggyback on some other programming that's going on to see if we can get numbers up. Start back up in some towns like Otis, Great Barrington. So we're open to suggestions of what could possibly work.
We have a new COA director.
Okay.
She's doing great.
Okay, good.
So that's gonna be huge.
Yes, and now you guys have that little room.
Yeah,
That would be good. That'd be a good place to have people come in to, get their blood pressures and talk or whatever.
yeah.
You wanna talk about men or balance?
Sure, so we were, trying to figure out the best way to go about starting matter of balance courses. And I believe we have decided that we won't be the master trainers, we'll just take the course so that we can, help hold classes. And I confirmed with, Isaac from Pittsfield that their person that will be taking the matter of balance master trainer course will be the end of this month. And then we'll kind of work on starting that program after the new year, once our clinic season is done and things like that. So it's kind of on pause right now too, just because we're so busy, but definitely gonna be offering that to the towns, the matter of balance.
And then one of the things we talked about too is having like, with the wellness sessions, maybe not every month, but like highlighting a particular activity. And so part of the conversation, I think, that Jill was talking about with having, finding out better next times is to start hopefully offering some programming that might be interesting to seniors as well.
Yeah, if I could add to that dialogue as well, we've been talking for quite some time on how to enhance our monthly wellness visits with our member towns. And it's been, for me, it's been a struggle, even going back to the VNA days, when we contracted to VNAs, it was one of those things where we paid VNAs nominal amounts of money, irregardless, to do, BP clinics. And it's something where one town will drive down there, pay 2 staff members, and one person shows up. And whether you have 1 or 10, it's still important, but like, how can we stack programs and how can we shore this up in a way that we get some broader participation? One of that is looking at the matter of balance trainings, which we used to provide through Prevention Wellness Trust many years ago. But you need to have 2 people holding the class. So, looking at who we can train and whatnot there, but it's really important that the towns tell us what they're looking for. I mean, can we go there an hour before a lunch or checkers or mahjong, and have the numbers? And can we bring like guest speakers in, and I don't know how to do your taxes, how to do this and how to do that. And we're soliciting feedback from a wider group and how to make this better. Does it make sense to go every other month? Because it does become time consuming to drive all the way down. I'm just using the term Sandusfield, for example, and nobody show up or one person show up, and then that's kind of that. We want to try to shore that up and really provide good offerings that make sense for the residents.
Oh, anything else?
Okay, so the quarterly report is the next thing. So this is just from fiscal year 25 quarter 1. And so doing this quarterly helps us also with our annual reports, which we're going to get into later for the towns. And it's a good just record and snapshot in time. If you have any questions, we've got of course, the Maven, which Jill is doing a good job keeping up on. Pam has been really helpful to be the backup on that as well. I'm a horrible backup. I don't know the first thing about talking to people about their health. So it's really awkward to me, and I think that their skills as nurses really come through in those moments. Yeah, and then the car seat program. One of the things that I think I'm really proud about this year, was it August or September, Pam, that you met with, so you were speaking with Rania Markham and were able to connect with
That was just last month,
September?
Yeah.
And so can you just explain that? Like, I think that is a success.
So Rania had reached out to Jane, to acquire a car seat for one of her community members. And I met up with her and brought her the car seat that she needed. You know, we have to collect the data, the weight, height, all of those things. And mom, she really struggles with her English speaking, so we didn't have a translator, but I did pretty well. I was proud of myself to be able to get that information and where she wanted the baby in the car seat and things like that. But it just working with the other parts of the community like Rania was great to get a car seat out there and, you know, get the word out. So just good community work.
And it's gotten to the point where when we see somebody who that works with the population, and I'll mention it because like I'm compulsively do that, and they're like, oh yeah, no, we've already worked with you guys, we've sent people, so I feel like the word is getting out there, which is great. Yeah.
Now that Pittsfield has they have a couple of techs and they have their own car seat program, I'm not running all over the county anymore, which is nice. I get a lot of phone calls from people and the first question I ask them, what town do you live in? And then I refer them to Pittsfield. So it's nice that the wealth is kind of spread and there's other people out there. So yeah.
When we're talking about the quarterly report, do you guys want to talk about the homebound program?
Oh my gosh, it is growing. I'm just amazed. We had somebody yesterday and, we put the offer out, the husband's starting to decline. I'm like, no, I'll put you on my list for next year. So we were at 50 and now we're probably 60. So if you know anybody, we pick up on people that are, come to our clinics and they're really having mobility issues. I'm like, I'll reach out to you next year. We'll just come to the house. So, it's great. I love that we're able to offer this. They're very grateful. I think now this is what, third year doing homebound, so there's.
And I took look at the numbers from last year. We're gonna be more than doubling what we did last year.
And when you do this vaccination, you would do the whole.
I do everybody in the house.
Right.
Yeah, so if there's caregivers, the wife,
Right.
the other,
Right.
Adult children, whoever's in the house, I vaccinate everybody there. Just so that way, I know sometimes it's hard for those, caregivers to get out of the house and then everybody's vaccinated.
And this is a self-determining request. I mean, it's not that you have to meet some
Nope.
standard of whatever.
No, they just have trouble walking or they truly they're bed bound. Yeah,
Transportation issues.
yeah.
It's hard to get somebody to transport just to the clinics. So.
Yeah. Yeah,
And
if somebody comes to the clinic and they can't get out of the car, we're like, we'll just come next year. So they're like, really? We're like, yes.
Yeah, great.
Yeah, it's great.
And the state also has a homebound, and they were talking about it, but they will only do it with COVID. And the difference, I think, also is that they're like, this is a great touch point for them to get to know us and feel supported by our team. And so I feel like we're really going above and beyond in that area.
Jane and Jill, can I ask a couple questions if you don't mind? I don't want to put anyone on the spot. Are the other programs doing homebounds as well? I mean, we're sort of covering South County, and I remember at one point we were getting some inquiries from some alliance towns, and they weren't doing homebounds. They're doing homebounds now, though, right?
Yes. Yeah, I get a lot of calls from Pittsfield. I refer them to Pat, and I know,
great.
Nancy, even though she's retired, she's still going out and doing homebound.
Oh, nice.
Yeah, it's great.
And the Get Vaccinated Berkshire's website, which is a compilation of all the different programs into one portal. Do you know if there's homebound information on there for I'm assuming there is.
Yes, there's actually a link that says if you would like to request an in-home vaccination, click here. And that
Nice.
goes to Berkshire Regional Planning staff, and we have gotten a couple of referrals through that.
Nice.
So, there's multiple paths to get to the same place, which is nice.
Yeah, and my last, and it's not really a question, it's more of a feel. I feel like our vaccine program is exponentially growing. I think we're going into year 3. It just feels like we're purchasing more vaccines, the demand's getting higher. Is that your sense as well as we go into year 3 and 4, that we're just continually growing this vaccine self-sustainable program?
Yes. And East Mountain Medical reached out because they were so short-staffed, they
They
wanted
did.
to offer, some flu and COVID clinics there, so probably have one next week. And they gave out our clinic schedule to all their patients as they come in, so. So yeah.
Yeah.
Yeah, we ordered, what, 500 more COVID?
Yeah.
300 more high dose. Because we had plenty of standard dose, so yeah, just because East Mountain Medical had called, so I was like, well. So yeah, we already have some people that are, can help in addition to our volunteer pool too.
And I sense there's good coordination. I do, this is only my opinion, it doesn't reflect anyone else's, but I do feel like at times there's a struggle communicating with CHP. I know our staff, you guys work so hard early spring and summer preparing for the flu season. And I know we reach out to many organizations, but I just wish we could figure out a way to do coordination, because you guys will be at a clinic staffing it, and then like the next day the van's there and vice versa. And obviously we can't control everything, but like trying to streamline, I wish we can do a better job. And I don't know if others have suggestions, but if we can, because our job is not to like do all the vaccines. Our job is to provide a service, provide a need, fill gaps as needed. And so, the pharmacies are doing it, the Alliance is doing it, others are doing it, people are reaching out, asking us for help. I feel like I don't know how to fix that. It's been a struggle for quite some time. And like, I'll see that we'll have a clinic up in Otis one day, then the next day the CHP van's there and there's only 5 people on the van. And if there's ways we can figure that out down the road, I'm open to suggestions.
I'm assuming we meet with them.
Well, so,
They show up and we don't even know they're coming.
Right,
And then they're
yeah.
like, we didn't know you were. on a-"
Well, no, I mean
So-
preemptively, I
well,
don't mean.
so preemptively, Pam reached out to CHP and gave them our schedule. It took us a long time to figure out, we had to like beat the bushes to get who the new contact was. Right?
Yeah, it was a struggle to get the September calendar, and they were working on the October calendar, which we never even got from them, and it just seems like it's kind of a last minute thing almost with them, and there's not a lot of coordination.
And
It
then
was.
people don't come, like the van was at our town hall yesterday. And I knew the day before, I'm like, oh, they're coming tomorrow.
Mhm.
So then there just aren't people attending because they don't even know they're gonna be there.
And then also Get Vaccinated Berkshires, we have meetings, so we participate in all of the meetings. Jill and Pam meet with the public health nurses monthly, right? So there's a lot of coordination in the Berkshires. But at the Get Vaccinated Berkshires, we were also not able to get them to come and represented. BHS was there. Everyone else was there.
So just,
And
yeah, okay, so they're difficult, but I wonder then if you just have to go up a level and just ask for a general conversation on coordination, sort of leader to leader, rather than deal with people who are trying to develop the schedule, but go up higher and say, look, we really want to collaborate and cooperate.
Yeah.
How can we manage that?
that's a really good suggestion, Pat. Yeah. So, and I think that too, like us setting our schedule so far in advance was to try to avoid that. Like today, they're at the senior center. We just
Right.
did almost 100 people there yesterday.
Right.
So that's, it's not a bummer for us, but it is a bummer for them. If someone didn't want to get both shots at the same time, it's a perfect time. It's a perfect opportunity for us to work together. And a couple years ago, when I was in Sandusfield, I actually did up a flyer that says, here are all of the flu clinics or the vaccine clinics coming to your community. And I included the CHP van because it's, again, what Jim was saying is it's not about who's doing it. It's about that, people are being supported.
I know now the CHP van is really pushing, like they're offering like urgent care visits.
Right.
In addition to vaccines, they're really trying to get people to utilize that van more than just the vaccines. Now they have Michael Jefferson, he's, I think, one that's running the van now. He's great. He was posting all these like informational videos on like Instagram, so. I mean, unless a lot of people, a lot of older people, they have a hard time using the computer or they don't have social media. So that's where I'm seeing they're posting their schedule where they're gonna be for the week, so.
Right.
Yeah,
So there's definitely work to do there, so, yeah. I'm trying to think of, so that's kind of the annual report, a quarterly report. I'm going to be pointing out that I didn't do, the stuff that, we're trying to come up with a good format for like inspectional services and agent services with housing and, we're just trying to figure out how to capture that. So we didn't want to put that information out there until it was kind of in final form so that because it's going to be informing the annual report.
You just didn't want to embarrass Sheffield, who's been overutilizing your services.
Well, last time it was a different town that would have been embarrassed, but yes, Sheffield, you're like really making us use our muscles, which is, that's what we're here for. Before we go on, I did want to introduce, we have a new face here. Bruce, do you want to introduce yourself?
Butch Kallstrom, I'm the Board of Health agent for the town of Alford. When I work with Jane,
Welcome.
we're kind of
Yeah.
the team.
Well, and Butch, you live in Otis, right?
I live in Sandusville technically. I live on the Otis-Sandusville line.
You don't live in the,
No, I know what you're gonna say, no.
right, because I'll give the Woodlands to Otis whenever they're ready.
They can have it.
Okay. So, this is a little out of, I put the thing in the wrong place. So, but Jason, do you want to just talk about, since it's in the packet right now,
Will you just go to the
Yeah.
animal inspector stuff?
yeah,
Okay, so, we'd like to start a conversation, we'd like to start a conversation with the towns in regards to their animal inspectors and their, barn inspections. The animal inspector duties really does fall under the boards of health. So just, wanted to start that conversation with the towns. We'll probably, go down the list that's updated by the state to coordinate who is the designated animal inspector for the towns. And just coordinate with them what they're doing in regards to barn inspections and rabies control. It's mainly what the animal inspector's duties are about is rabies control, quarantining of domestic animals if needed. Generally, they work with the veterinarians in the area. If animals, cats come into contact with wildlife, it's the animal inspector's responsibility to place the quarantine and keep track of them. The other main part of the animal inspector's duties are barn inspections. Barn inspections have become largely a census for the state of the domestic animals, aside from dogs and cats, and making sure that they're in good health and have the necessary shelter and food in order to be in healthy standings. So just if anyone was interested, I did bring a copy of the barn inspection book that we use for Lee and Lennox. I am an assistant animal inspector, Dr. Jim Leahy, who's been a long time vet and animal inspector for Lee and Lennox. I've worked with him, looking at the process, and going through a couple of animal inspections, barn inspections with him. So I'm sort of developing as an animal inspector, but I see what's required and, yeah, I guess we're just gonna be touching base with some of the towns and their people, making sure the list, that the state has for the animal inspector, is, accurate. For example, Sandusfield, Kim Spring is still as the animal inspector and animal control, who has been long retired from the position, so, you know, that's just an instance of, just checking make sure that everything is accurate. So that's basically, I'm gonna be starting that conversation with the towns individually and, going from there, so.
I have a concern, we had an animal inspector in Sheffield who was reporting to the police, sort of for backup on some issues of difficult people, and to the Board of Health. I was notified of all the activities she did. She has resigned from that, and it is now completely in a particular police officer's hands. I have no idea what he's doing, and I have talked to the chief a couple of times to say, you know, you're following the state regs, or what's going on, but I'm not getting any reports, etc. So when you do Sheffield, I would like to be involved, so that I can have the confidence that it's being done in a way, and that the board is engaged in a way that it should be.
Okay, of course. Yeah, I plan on having a conversation with, Michael Cahill, who's the, animal health, director, and Ashley Kraft, who's the, rabies control program, coordinator, in regards to what they really expect from them as far as duties of a barn inspection or duties of a dog quarantine, more specifically drawn out, so a
And
town
how
like,
it,
and how it should be conducted, yeah.
and how it engages the Board of Health.
Yes.
Yeah, great.
What
Thank you.
initiates a barn inspection, like what?
They should be done, so it should be done annually, it should be done annually, so that's really, I don't know what initiated, but, you know, having. My understanding is any backyard chicken, should really be accounted for, I think, and I would have to confirm this with them, that even a backyard chicken coop would be considered a barn and subject to a barn inspection. That really, under that definition, that becomes a big workload. So again, that's where I need to have a closer conversation with the state and to figure out what's the best course of action from the collaborative's point of view with these towns.
Given the new issues we have around transmission from animals to humans, and cows in particular, this is a real concern.
And
I
it,
think there'd have to be a little public outreach or something, like I've never heard of barn inspections. So I think if we started showing up and wanting to see people's barns, it wouldn't be well received.
That's certainly been the case in Sheffield.
although Cassie did a good job with like putting it out there, like, hey, I'm gonna be going around, please contact me if you have animals. And they're just looking, make sure they have food, water, shelter. And the funny thing about, because it is a Board of Health responsibility at the end of the day. Animal control, no, that's a police thing. Animal inspector is about the well-being of animals for the transmission of disease to humans. So it's a census. But also like, it's the rabies. And I think that it can be done, it probably does need to be done with a light touch at the beginning. The three towns that I feel like are at the most risk of not meeting that expectation at all right now are Mount Washington, which doesn't have anybody.
Yeah, there's livestock on the mountain.
there's nobody listed on the website for you to be an
Oh.
animal inspector.
Okay.
Then Sheffield, which was able to,
Feel that.
fill that, and maybe it would be getting some supporting them and helping everyone get on the same page as to how we're gonna work together. And then Sandusfield, is the third, and there certainly are plenty of animals in Sandusfield. So,
The actual,
so I just,
I'm
go ahead.
sorry, go ahead, Jane.
nope,
This is a bigger conversation to have, in my opinion, to put this into context. When we did the card assessment, a couple of years ago, when they inventoried all the work that we're not doing and doing to create that dynamic and data set to figure out where the gaps are, the fun PHE. Animal inspector is one of many Board of Health duties that just are, no one ever thinks about that, right? It's limited funding. The general laws are pretty broad. Like, for example, Monterey, the chair, Dr. John Maycook, he's been doing it for years. When towns that do have animal inspector, the stipend's super low. And even the laws in animal control have changed. They have to be certified now. And so, like, the idea in my mind would be like, let's get an inventory who's out there for animal inspector, A, B, figure out the gaps, C, Jason, does the state have a list of references and resources in the laws that require the animal inspector work? Get that out to people, and then maybe have a broader conversation, because as time goes on, is there a need to pool the resources to have a combined animal inspector, which could also not only satisfy the towns that are already doing it with a limited stipend, but maybe look at the towns that aren't doing animal inspections and make it kind of more of a standardized thing. Because when the CART assessment came out a couple of years ago, there are all these things that boards of health haven't been doing for a gazillion years that they're technically required to, but nobody knows because they haven't been doing it. So that's sort of like the context, in my opinion. Like, Lee and Lennox have a shared animal control and animal inspector, and that's thankfully Jason. But like, when Dr. Leahy, who is our limited animal inspector, retires and leaves, I'm gonna have a hard time filling that position, right? So there's going to be a need for animal inspector down the line. I wouldn't suggest like all of a sudden going out and blitzing all these communities and showing up to do chicken inspections, but more like just let's get the conversation started on the gaps and needs, figure out what's required, and then maybe figure that conversation out down the road.
mhm. And that conversation might also be helpful. Now I'm going into animal control, but there's also a need, there's no places to house animals, like even if an animal needed to be quarantined, right? Like, except for in Lee. And maybe,
Beckett has a, kennel, so we pay them a few $100s a year, so and we also have the same animal control / inspector. So she can bring the dogs or whatever they
I'd
are.
be interested in touch base with the kennel, or whoever manages the kennel in Beckett, just to talk to them.
I can forward.
can everyone hear Jim? Should I turn up the volume, or is this good?
It's good.
Okay.
But yeah, to Jane's point, one of the. Yes, I am an animal control officer. I've gone through the classes. In those classes, that the state provides, the animal inspectors who are in training. The hardest part of the conversation that I hear is a place to house the animal, even for a short period of time. Whether it's, I mean.
Stockbridge has one too.
John Drake, right?
They have
he uses
like
the-
an area,
Yeah, I believe, was it part of the police
part of the highway
or
garage.
the highway
Yeah.
garage, okay? But that being said, there's scarce resources to physically house these animals, either whether it's for a bite hold or a stray. So having that facility, I'm grateful that I have that facility for Lee and Lennox. Otherwise it would make my job very, very difficult. I I live in Pittsfield, even if I lived in Lee or Lennox as an animal control officer with an animal at home, I don't wanna be bringing an animal home. I don't wanna be using my home as a holding spot for an animal, and I don't believe any animal control officer should be able to do that. Even in my truck, I had, I'll say, one scenario where was dealing with a cat that was laden with ticks. And I didn't have, I had the holding crate for it, but an hour later, after I dropped the cat off wherever, there's a tick crawling on my leg, and it was obviously from the cat. So there's a lot of, I'll say, risks or scenarios that aren't really taken into consideration as animal control officers. And we're kind of getting off subject, but so yes, there's a very large conversation to be had when it comes to animal inspections and animal control duties. And like you had said, nobody had, like Jim was saying, nobody knows that barn inspections really should have been being done for 100 years, but the reality is that they should be.
Mhm. Thank you. I guess since it's, so the next thing is the annual town reports. So this memorandum that you see, this is something that we're required to send out every year before October 31st. I haven't sent it out yet. It needs to be sent to like your town manager or administrator, this chief financial officer, select board chair, board of health chair, and board of health, agent or inspector. But before I sent that out, I just wanted to talk to you guys about that it's going out so that you know what it is. We also later on are gonna talk about a procedure for requesting help from the collaborative. And since I'm sending it to all these people, I was thinking it would be a good opportunity to also just either in the email or whatever, also just say, we're available, here's the process, just to gain visibility in our towns. So people, when Jane Smith shows up somewhere, that people know who I am, who Jason is, who Pam is, who Jill is. One of the things we're trying to do is just increase our visibility as a resource for the townspeople in the towns. So I just want to have a conversation about that. Would you want it to be a document? Could it, like, on our letterhead that's kind of like a memo on how to do it? Should I just email things? Like, what do you guys think would work best in your own community?
I want to be sure that the Board of Health is not left out because they're coming directly to you.
So in there would be the process would be to go through the Board of Health. Right, because we help you, so
Right.
that's something that,
In bold letter.
I'd like it in a document, like you said, because then it's something I can print and put into. Like I have a binder for like situations, and I can go right to it, so then if I needed help, it's in there and it's all
Mhm.
laid out.
so, but document, we will have in there that it goes through the Board of Health.
Right.
In terms of getting to more people, what about, a letter to the towns individually from the Board of Health with your bios and photographs?
We did take photographs. All right, and I still owe my bio to Pam, so she'll be happy for that.
So you mine too.
So, Pam's been working on a newsletter, and we took pictures and we have content, but then clinic season started,
Yeah, it's
So-
a busy time right now.
but, I think, all right, so I think that we are gonna be doing a newsletter. Since time is short, if we can pull something together, maybe this is just what we all need to like, well, get Pam what she needs to do that. So maybe we could have our first newsletter go out, if we are able to. So that's a great idea. If it's not for this time, it's definitely
Yeah,
coming.
Yeah, and another thing might be just that you wear like name tags that identify who you are,
We do have,
the cards.
we do have the cards now and with
Yeah.
updated. And Jordan is starting to do some of our food inspections, so he also has, does he have his?
He does, yeah, and I should have my finding, but I don't.
I just mean when you're out in
Yeah.
the community, you know,
Yeah.
when you're out in the community, you have that. so
Especially
people-
when I go for homebound.
Yeah, yeah.
When you can see, we have some shirts and like Pam's wearing that, Jason's wearing it.
But, yeah, the IDs are, we have them.
Yeah.
for sure.
And I think the other thing about, that's good about this going out is if someone called the town and they're like, someone from this Southern Berkshire Public Health Collaborative. If the office people know who we are, it's very helpful.
Yeah.
Cause I've had that happen in Beckett years ago. And they called and said, Jane Smith's here to do an inspection. And the town said, I don't know who you're talking about. And it was not great.
That's what happens when you have volunteers running your town.
Yeah. Okay, so, the next thing is, a draft town report. So this is something, that, the fiscal year 24 reports are starting to be due for all of the towns. And so, we actually have the rough draft for each town already done. So with all of the diseases, if people want that, we're not doing it this year, but for next year, we'll have all the data for if we do inspectional services in your town. Then we will include that. It would give information on our mobile vaccine clinic, including town-specific information about how many people got vaccinated and then a note about the in-home vaccinations.
So you just said you're not doing it for this year?
Oh, this year, we're not doing, for like, for this year for Sheffield, we can do Sheffield because that's pretty easy, but like, Sheffield, Sandusfield and Mount Washington, we didn't start really collecting the data in earnest until halfway through last year. So, so we don't want to have to present half of what we collected. So we're starting with next year's report. It will be a full report.
Right.
And because we're keeping track of it as the year goes along, it will be really easy to extrapolate.
Right, okay, so we need to work together for the other half of the data, hopefully we.
Yes, for Sheffield, but probably not for Sandusfield. That has never been included. And with Mount Washington, we can talk up to the board whether you want to have like, information is like how many permits were issued, how many inspections were done.
Is that not picked up with the, permit eyes?
We have not started permit eyes in, so yes, it is in Sandusfield,
Okay.
but it hasn't been implemented. But again, even in Sandusfield, we started permit eyes halfway through last
Yeah.
fiscal year. Cause we're not talking about now, we're talking about last fiscal
Yeah,
year.
yeah, yeah.
So, so I kind of included, this is actually Great Barrington. This will be worked on, in the next month or so. So if, I just wanted you guys to look at it and get me back resources or feedback on what you would like to be included. We can do a little bit of customization. Especially for the towns that we provide the other services to. But yeah, that's that. And then the last thing for the shared services manager is, MHOA, has been working with the state for non-tobacco towns, so from the MTCP, to provide possibly even, some enforcement activities. And so like Sheffield, New Marlboro's a town that is not, that has, tobacco retail establishments, but is not part of the program. Sandusfield, and I think that's it. I think it's just those three. And so, we'll need to have a conversation with each of those towns to see whether or not, you would like for them to try to do a youth inspection or, go in and do the minimum pricing. We are providing packets of tobacco education to those towns, but,
Right.
it's kind of outside the scope of what we can do right now for actual. Jason?
No, I was just saying, if anyone wanted to see the information packet that we bring to the retail tobacco establishments, I brought one of the folders here with the information. If you want to look at it. Sorry. I didn't mean to-
All right, Brandy, I've blown through mine and half of the next one.
Under new business, I think we're down to the support letters.
There was a support letters, it was due October 8th, and I realized that last night, so you guys are off the hook.
Trainings and workshops. Working groups.
Yes, so it quite frankly has been nice for me not to have to put this agenda packet together monthly, but I will say there's a lot that goes on between meetings, and I feel like it's not enough. And so we have talked about doing the working groups. Or we had talked about doing the education, and one of the ideas that the staff, we had kind of brainstormed, there's kind of two options. One is to do quarterly with at least one training in between. So like, for instance, I would like to do septic and housing are our two major things that we would doing the training, but there's also emergency management that we could have a guest come in. There's also getting signed up for your train accounts and taking some of that education on board for Board of Health members. And so so the two frameworks that we had kind of talked about, and I would love your guys' input on, is either do we want to keep having the meeting quarterly and having on the same time, so Fridays from 9 to 10:30, having a training available to anyone in the Board of Health that would like to come. So that's one option. And then and sometimes it would be us doing the training, and sometimes it would be a guest speaker doing the training, or doing meetings every other month and getting away from the quarterly thing. And then still have the meetings every Friday, on the off times, still having a offering of a training during that time period that would be open to everyone. So what do you guys think about those two options?
You went from every month to quarterly, right?
Mhm.
So maybe you should go back to every other month. If quarterly isn't enough.
Well, the quarterly, yes, so that is one option, and then have a training in between those times. And we wouldn't have to have a quorum for the training. It would be just whoever wanted to come to the training. So, yeah, that's.
Jane, a
What
couple
about-
ideas. So one of the reasons why we went to, I think there's a difference between goings on and there's all this stuff in between, and then business of the governing board, right? Like, I think we decided to go quarterly because people were just meeting monthly, and we did that, when Pat was chair, when the collaborative was kind of up and running, and we still had our training wheels on, and we were still trying to identify all these different things. And there was a lot of work that went into, the intermunicipal agreement, creating the governing board. There was a lot of work that went in related to the tasks specific to the governing board. And then there's all this stuff that happens in between, right? Inspections, we do work with each town individually. So we decided to go to quarterly to make it easier for people, because you know how it goes when you start meeting monthly just for the sake of meeting. People just get exhausted, they get tired out. We get less people. We have less people now than we did a year and a half ago. We used to have all 12 towns there. And so try to be mindful of people's times. If Brandy's probably got the day off today, and and just trying to be mindful. And we do have a provision to meet with the executive board if something crazy comes up, like we have to write a grant or something like that. So you think about that, and then in between, one of my thoughts and ideas, Jane, is if the governing board still wants to keep it quarterly, maybe after flu season and you guys actually get a couple days off rest, send out a list of topics that can be kind of ranked for most important to least important. And then maybe we put out a schedule of like a webinar series, for example. like, February, April, June, whatever, like 6 times a year, we're gonna provide these trainings. Here's the schedule, here's the link, and everyone knows that the training's there. Rather than trying to every month trying to reinvigorate a new schedule, maybe we try to adopt as a staff and board a list and a schedule of the annual trainings that could be subject to change, obviously. But like that way there, it's all set in stone. Everyone knows their schedule. They know the trainings, they're voluntary, not required. And maybe just to make it easier for the governing board and the staff. Those are just a couple ideas.
I really like that idea,
Yeah,
Jim.
me too.
I like knowing in advance so I can beat on my board to participate. I like the fact that it would be available on Zoom because I'll tell you, my board isn't gonna come at this time of day on a Friday. And I can't blame some of them. They're working. They're, as we try and attract younger board members,
Yeah.
they're not sitting around, like some of us are.
And we could record them.
And you
Yeah,
can
it
record
could
them.
be, people
Yeah.
could access them at any moment of the day.
Yeah, yeah, I do like that.
Yeah,
And I think it might be easier on you guys, where you don't have to drum up business every
Yeah.
on the spot, sort of, that it's scheduled out there, you know who's doing what, and you go with it that way.
So what if on at our January meeting, by our January meeting, we could put out that Survey Monkey or whatever to all the board members, like, so in all of our different boards, we could have that and engage them on what they're interested in. And then, we'll use that to inform our list of things, of topics, and I can bring that to the next meeting. And then we wouldn't be starting anything till January anyway, because I need December to just catch up.
You deserve that time, absolutely.
I'll have that together, and if you guys don't mind, I'll just assume that whatever feedback I get, that I don't need approval to bring that to the January meeting to distribute. We'll go from that, go from there. The question really becomes then the timing of it. I'm okay with meeting quarterly if we're doing things in between. But I do think like quarterly or every other month. I just wanted to see what you guys thought about actually having a meeting.
And quarterly for business purposes, this point is probably okay. Because we know that if there's anything weird that comes up, as Jim said, there's the smaller group that can initiate action, and we could call a meeting, even if it were a Zoom meeting.
Yeah, we could even call it at the end of, like, we could do the training and then post a board meeting right after the training.
Yeah.
If we needed to, for like grant purposes or.
Right.
Okay. Does everyone feel pretty good about that approach then?
yes.
Okay, thank you for that. I guess since we're not changing quarterly, we probably don't have to vote because on that. The town budgets, so that's the last thing. Last year, we didn't raise our fees at all. There was no like cost of living increase or 3% or whatnot. But this is the time that we all should be thinking about putting in for our budgets. And so we want to be providing a service to the towns and having them benefit from the grant. There's also the sustainability piece. So I felt like that really was a board discussion around like, as a board, while we're establishing ourselves, do we want to have it be flat, same as last year? And then, or do we want to implement just like incremental increases so that we're not losing capacity every year? In 10 years, this grant, we don't know what this grant's gonna look like in 10 years. So thinking about sustainability. So I thought I would just see what you guys thought.
I think you'd be nuts not to increase it annually. I think
Everything
that's the
else
only
is
way
fine.
my town is going to put more money in my budget, is if you guys come up and say, oh, we're going up 3%, 5%, whatever.
That's exactly what I
Yeah.
said.
Yeah, I just, they're not gonna do it, on a general request, but if I've got evidence that, look, the costs are going up for the services we're rendering, that the collaborative is rendering, and look at all these services that they're rendering, I'm sorry, but we need to increase the budget, and I'm not sorry, we need to increase the budget.
Sorry, I'm sorry.
I mean, our town generally gives a 3.5% increase to employees and whatnot, and I would imagine that would be fine with our town. I mean, fine and not fine, because people don't like to pay taxes.
But people aren't gonna bristle at a
No,
3.5.
No,
Okay, this would be something that would be really helpful if we could maybe call a vote.
Do you have a percentage in mind that you think you need?
I mean, right now, need is as an underscored need, right? I'm thinking about in the future, not necessarily in the now. So like 3% is a really easily calculated thing. It sounds like Mount Washington does a 3.5%.
Can I ask one thing though, is if you have a grant, and the grant is so much annually, is it the same each 10 years?
Yes.
Yeah,
Okay,
I can
So,
help answer
yeah.
this question.
yeah,
So-
so you do need a.
Jim has feelings.
So
3%.
someone who has managed grants my entire career, grants are great, right? Let me use my tobacco control grant for an example. We'll get a 10-year contract, for example, right? It's the same amount from year 1 to year 10. However, we have employees.
Uh,
Am I here? Can you hear me?
Yeah.
Okay. Everything went blank for a second. So for example, and I've been talking to DPH about this for a long time. Grants are great, but cost of living increases go up. You know, we have employees actually that have longevity, for example, insurance rates go up. And when you're taking the same pot of money year after year after year, you have to start making cuts to supplies, cuts to mileage, cuts to training, et cetera, and so on and so forth. And so, yes, it's something that we need to consider, and I'm just gonna make life really easy. Jane, you should ask for a 3%. Put that ask on the floor right now and just do it and get it over with. And then we can be there to defend that or speak on that when it comes to your Board of Health meeting, Finance Committee meeting, because like you don't level fund your municipal budget every year because there are goods and services that increase. And so the good thing here is we have a special revenue account. The money goes into the account. We purchase vaccines. Vaccine costs go up. You know, the travel goes up. You know, Jill and Pam and Jane and Jason are doing a lot more travel now. And there's only so much we can do. And if we want to keep the programming and enhance it, we're going to have to think about this down the road. Nobody wants to increase fees. I'm going to have to increase my household hazardous waste assessment in the next month or so for next fiscal year. They'll be getting those emails as well. But Jane, I would ask for a motion on the floor, make it happen, and maybe get those invoices out as soon as possible for next fiscal year, or at least the numbers.
I'll make a motion that the collaborative towns, the FY26 budgets include a 3% increase.
I'll second that. So you guys don't have to go onto bicycles for your transportation.
Thank goodness.
So because we have members on Zoom, after we're gonna have discussion, then we'll have to do a roll call vote.
Any discussion?
All those in favor?
But you need a roll call.
Oh, yes. All right. Pat,
Yes.
Brandy,
Yes.
Jordan.
Yes.
Sorry, guys. You don't count. You don't count.
Betsy.
Betsy.
Yes,
Would you like to represent Alfred today?
Yes,
Jim as for Lennox,
Yep.
right? No,
Stockbridge,
yep.
yes.
Stockbridge. Ellie? She's still on?
Yep, she's there.
She was there.
Yeah.
People seem to
is she on the Board of
disappear.
Health though?
Oh,
She's trying to get back in.
she was designated as a backup for
Lee.
Lee. Yeah. All right, I'm gonna unpin you, Jim. Hey, Ellie? It's okay, I think.
Yeah, I got,
Yeah,
I'm here.
so we
Our
have a
internet
motion
went down.
in Mount Washington, that's so weird.
No, I'm here in the office.
Oh, no, that actually isn't weird.
It's always going down.
So we have a motion on the table to increase, the annual public health nursing and other,
Collaborative fee.
collaborative
Assessments.
fees assessments by 3%. And we're doing a roll call vote. What say ye?
Yay.
Okay,
It's unanimous.
it's unanimous. Perfect. So on that same topic, and also on the procedure, one of the questions that I have for you is, the towns that we work with regularly, we already have an established fees. So like Sheffield, we capture their fees from the inspections that we do that collect the fee. And if they have housing, we charge an hourly rate, which I think is $60 an hour. So that's how we do Sheffield. In Sandusfield, they pay, any of the revolving funds come to the collaborative, 90% of them come to the collaborative that we collect for work that Jason or I or Jordan's doing. And then what we do is, because he's the agent for that town, they have an annual assessment, which will be going up by 3% from last year for agent services. The same thing goes for Mount Washington. We're collecting 90% of the fees that come in for the revolving fund. If so, like a septic inspection, we collect 90% of whatever Mount Washington charges, and then they have an assessment for us to provide them with those agent services. Again, going back to, we want towns to be able to benefit from the services. We don't have other contracts with other towns. So like, for instance, we were called into Tieringham the other day to just assist with a housing situation. And there's no mechanism for us to charge for that. So the question is, you know, do we want to work towards establishing a kind of a fee for service? Do you think that we should have like little towns that don't really use us very much to be able to have like one or two things that we can assist them with every year, just as for being part of the collaborative in good faith? We support the towns and provide technical assistance. That's the benefit that I feel like is an important thing that we provide, that's not, I don't feel like could be captured. But what do you guys think about the actual, like a housing case, for instance? Should we have it be that we just do like 2 or 3 complementary things throughout the year? Or at what point do we start having a contract? So that's the question.
You've got me confused, I'm sorry.
Well, welcome to my world.
These towns you're speaking of now are members of the collaborative,
Yes,
so they do pay into
the nursing, the public health nursing.
nursing.
Like, we have an
aspect.
assessment, but we don't use you for the à la carte.
Right.
Type inspections and things.
Okay, so housing, food, who knows what else, is not covered by that nursing aspect. So I don't understand why you wouldn't charge for those things. Why would you try and shoehorn it in under the nursing fee and have it be free for 2 of them or something? I don't get it.
I think it's a matter of just having an agreement that's in place, and then if something comes up.
Yeah.
And we do use you, then we have the mechanism, you know, to pay you.
I don't mean to be mercenary,
yeah.
but you're doing a service, and in a sense, the rest of us are paying for it, or the collaborative is paying for it. If if you're not charging them beyond the nursing aspect of their fee.
Jane, here's what I would do is, we voted on the 3% assessment, which almost all those funds are used to purchase vaccines. I mean, let's make no mistake about that. All the money that we're pulling in from the nursing goes towards the vaccine program. Sheffield pays us separately as a contract, and Sandusfield and Mount Washington pay us separately as a contract to provide other services. One of the reasons why is we can't supplant funding. Like you can't have a line item in your town and then, give it back and then expect free services from the collaborative. So that's why we have to capture those funds. Now, there's a couple towns like Tyringham that really doesn't have a line item for health agent services because they really don't, that's not set up that way. And so we already have a contract, kind of like a template that others have already used. We should just settle on a rate for those services. And if and when those towns need services, then you can negotiate and get that contract signed in addition to services outside of the vaccine nursing program. For example, I get hit by a bus or something, I get hit by a bus or something and Otis has a health agent line on them, it's vacant. They now have the money and resources to entertain health agent services, and it's not a huge lift, right? So you're kind of like setting up towns that may not need the services yet, but if they want to engage, they'll have the resources there. They're not supplanting and violating the grant. Does that make sense, everyone?
Yeah. If it's done in advance. I mean, I think you want to be sure the town knows in advance that if they call in a housing inspector, it's gonna cost them this much.
Yeah, I get it. At the same time, most of the towns are covered, right? Every town has sort of a health agent. It's very rare we're being called into towns to help do subsidized services. But we're also, at the same token, we're also a collaborative. We're not in this collaborative to make money on other towns. We're trying to build capacity long term. And so if town A needs services more often, we'll work with that town and say, look, you should probably develop a line item here, to cover housing inspections, kind of like we did for, my mistaken, Jane, we worked with Mount Washington to build some coffers and Sandusfield and Sheffield.
Yeah,
we got to
we
work
have a
towards
mechanism
that.
for all of those towns. And I agree with, I also feel like with what Pat's saying, with it being budget season, it might be worth sitting down with each of those boards and just say, hey, maybe you want to just start having throw a new line item in your budget so that if something comes up that you have the ability to help offset those costs.
Yeah.
But I do feel strongly like the technical assistance piece, I'm very uncomfortable with. I feel like technical assistance is different than actually doing the thing. So like actually doing a housing inspection is different than someone calling me and being like, hey, what should I do? Oh, here's some things that I would do. I feel like that's different, but you're right. If we're actually doing the thing, we should maybe work with the towns to have a line item budget and then maybe work on some sort of agreement so that we're covered and we can work in live time. What does everyone think about that? Ellie?
The caution that I have is that you've just been through some situations in towns that were housing inspections that ended up taking up a tremendous amount of time. So I think it's great to get the towns to have a line item so that they have the mechanism. I think that's very important. But I also think that towns have to realize that if they're going to have the collaborative spend that kind of time on an issue, whatever the issue is, that there is a big difference between technical assistance and actually having to do the actual project. So one of the things that I had understood as far as long term, not only building capacity, but also was eventually for towns to be able to manage on a as full time as they possibly could financially. So I think you do have to let them know how much it will cost them to have you do a service. I think that should be fair across the board so that you're not charging one town a different amount than you are for another for an actual project. But I think that the towns that don't have line items, that don't have budgets, that don't have personnel to take care of this have to honestly understand that at some point, the message is that you need to move on and become an independent and do what you're doing. Like, what's happening in these other towns, the boards are slowly beginning to be able to understand what they have to do. And the town fiduciary is beginning to understand that they need to support that. So it's not just the boards of health, it's actually teaching the fiduciary ends of these different towns, whether they be select boards or town managers, that they have to be realistic about what it costs to do these things. So that's my opinion. I just want to see the collaborative protected. We cannot use funds from other things. We can't do that, and we shouldn't do that. So I think, I just think a sound explanation and not, I don't know. I don't want to say giving away everything because I'm certainly not opposed to us helping. But I think we have to retain the fact that towns have to come to the table as well.
So what about for the next meeting, I mean, we already have a draft contract with the other towns. They're identical between the three towns. What if I brought that to the board, send it out ahead of time and have that approved? I don't know if it will be in time for budget season, because different towns develop their budgets, but in the meantime, we can talk to the different towns about having a line item that's sufficient for whatever they anticipate their needs gonna be. So that's the conversation.
Jane,
There's
I was.
another funny angle to
Go
this.
ahead.
Just thinking about the experience that we had with the Alliance, which over time, through the vaccine reimbursement, ended up with a large coffer. I'm assuming if this is a successful season in terms of recouping vaccination costs, that we could eventually build up a certain amount of funding from that resource as well, and thinking in advance how we want to use that. It seems to me the Alliance is sort of confronted in an unexpected way with having to figure that out now. So we might take that as a lesson and think about how we would use that, maybe an agenda item in the next meeting or something.
That's a good idea. Well, and I think, adding capacities. So Jason's taking on he's the agent of 3 towns now, right? And I feel like that's
a lot.
I've done that. It's a lot. And so I feel like as towns come in, and want more services, we need to have a deeper bench. So that's why we brought Jordan in to help with some things. And I feel like the money that we're bringing in, if we do end up with all of the money we bring in is going to be capacity. If we can count on it, then we can look at funding positions for helping. It's the uncertainty piece of it. You don't ever want to have a position that's funded with uncertain money. But, like we knew how much vaccine to order this year, and we knew about how big the clinics were going to be. So we're now in our 3rd year, so we have some of that data, whereas we didn't have that before.
Jane, my only question is circling back to like bringing a copy of the contract for vote. My suggestion, it's up to the board. I wouldn't approve like a formal contract. I would look at rates, have the governing board look at, here's the language that we charge for, housing, whatever rates that you have, because some towns may want some or less of certain things, right? and having a standardized contract prevents the ability to add and subtract certain things that the town may or may not want. I would maybe just look at the service type and what the rate is and kind of just say, let's look at that. Cause you know, like, say if Otis wants something completely different and we don't, and Sheffield doesn't want that, rather than come back to the board because they approved one specific contract, you want to be a little bit more flexible. I would look at maybe the rates and services and bring that, like a schedule of fees or something, for example, bring that back to the governing board. You know, and
The
getting back
problem
to, oh, sorry.
Well, I was just thinking, the problem with that is that I may choose, A, B, and C, but in fact, during the year, D comes up.
Yeah.
And it's not included. If, all I'm looking for is, and if you need it, this is what it's going to be. The full range of possibilities. And then as the year goes by, I just used a septic thing I didn't know I was going to need, and this is what the charge is.
Yeah.
And I've agreed to that charge in advance. I
Yeah.
may not have budgeted it, but I've agreed to it.
Yeah, the rate should be the same, in my opinion. You don't want to start carving up certain things. The only thing that I was always worried about, and it's come up a couple times here, is when we get involved in housing. Like when we get involved in housing, it's a lot different than a restaurant inspection. You know, you do a restaurant inspection, worst case scenario, you hold a hearing, Board of Health deals with that. Housing is very complicated. It sucks up significant amount of time. And one of the things I mentioned to the staff before, you know, in hindsight, is like towns need to have their town council support us. We can't, no one can assume that our health agents are going to take on all the legal ramifications on behalf of a town. Towns need to have their town council assist the health agents. And that's something that I deal with on a daily basis at Tri-Town and many other towns, but like there's been some serious complicated housing cases in some of our towns, and it took a lot of energy and time up. And so like towns need to step up too and be able to offer their legal counsel if and when we need it, because we can't do it all ourselves as health agents.
Well, and one of the things that I am finding too is like, housing. You know, the boards of health do have specific things that have been outlaid that we're responsible for doing. So if a complaint comes in, the Board of Health has so long to look at it and document it. I feel like we've come a long way in some of our towns on like documenting that and getting a process together. That's great. But, you know, I also feel like the difference between a landlord-tenant issue, which is literally like the backbone of our housing program, is more that would just, we would have to do that. You know, we've had a town who just started looking at properties that they would like, you know, to get cleaned up. And we've had to say, it's Sandusfield. All right, it's Sandusfield. Where we've had to say, you stop. We have spent hundreds of hours doing this very thing for owner occupied or nuisance property. Like we can't just be spending 45 hours a week between our two inspectors chasing after a building that's been there for years. And so I feel like having some expectation and prioritization of what a housing case even means, because it's the owner occupied ones that are going to court. And those are the ones, and it's not that I don't feel like we can provide that service, but like maybe just one a year. And I think even the Alliance started doing that with towns. It's like, you know, we can do one
Where the
nuisance
training
housing.
comes in.
Yes.
Yeah.
There's where the training comes in.
Yeah.
For
So,
us.
yeah. And so those conversations, we'll have a forum now to have those conversations with housing and processes. So, okay, that we've got 10 more minutes. There's actually, do you mind if I just keep going? Okay, so MHOA conference, if anyone would have liked to gone, it's not too late to sign up. So reach out to me if you'd like to sign up for the MHOA conference. It's in Springfield this year. You can do it just one day even, and there's now a schedule of things. It's a great conference. You'll meet a lot of great people. Totally Title V is another really good, and maybe some board members that are interested in Title V, that might be a good thing. We can pay for the registration fees for those trainings. So if you have board members that are interested in Title V, let me know and we can get them signed up. The train, I will be going to the different, we will have a training about the train system, and I'm working with them. So like if you're a Board of Health member or a Board of Health secretary and you sign up to your train, you're already telling them what role you're doing. I'm working with them to automatically put the list of things that you should be doing automatically, or working with me so that I can add them. So that I just had a meeting about that yesterday. And the reason why I'm going fast is, Butch actually came, we've been having some septic issues, some septic installation issues, where they weren't done according to the plan. They're not using the right material. They're not preparing the site correctly. They're not pulling permits ahead of time. They are moving septic components without getting permission. We've talked about having some accountability in this group, around, sharing our experiences and also, looking at regulations, possibly like a model regulations from this group that we could individually adopt as boards of health, just to really help protect, the
Including
process.
penalties and fines.
So we have an enforcement mechanism?
So that we could help develop an, expectations and an enforcement, and also a sharing of a mechanism for us to all share when we have a problem. Cause they'll go from one and then they'll go to the next one. And so anyway, that's the whole reason why Butch is here. And there was a lot of other things, Butch.
Yeah, I mean, when you come right down to, a lot of these guys, they're not engineers, they're just guys out working. So they don't even look for property lines. And then you go to do an inspection and like Alford is 50 foot off the property line. That's in the books. And they may be 10 foot or 15 foot. You know, so I think there should be some accountability with the engineer who draws the plans. The property line should be marked out. I think there should be some accountability with the engineer. He stakes it out for you. I mean, yeah, there's probably a fee, but we already had the case that one was put in back in the 2000s, early 2000s, and the engineer signed off on it. Everybody signed off on it. Then the new one goes in next door, the engineer signs off, who's the same engineer, and then it becomes a property line issue of the setbacks. Well, there's got to be accountability on the engineer's part, not the Board of Health agent, you know, and if you don't have somebody to back you up, it makes it really tough, you know, to dig up information or go back. And a lot of these towns that I've been, you know, not just as an agent, but an installer, they don't have records way back. You know, you go do a Title V inspection, there's no records. You know, you can go to Blandford and all the records are gone. So you're looking for stuff. So, you know, I mean, that's why, and my other big issue is with the installers. And I've talked to Jane about this. Anybody can sit in front of that computer and get a license. And I know of guys that have gotten the licenses that have never put one in or never done nothing, ever had any training or anything. And I really think it's, if you want to be a plumber, you gotta work with a plumber. So, I mean, I really think we need some accountability as to who's getting the permit to install it, where the licenses, where their training is. And this is some of the things I've talked to Jane about. And I'm really concerned about it because I've seen it several times. And you ask, how'd they get a license? And
Is that second step of the BRPC? What,
Berkshire County Board of Health Association
is that what it is?
Installers Licensing Program.
Right, which is a separate thing from some other license that they get.
So then every town issues their own installer's license.
Right,
And so this is a situation where like on a and in April, we could say, it doesn't have to be a training, we're having a roundtable discussion with some proposed, it would be like a working group, and everyone could come to work on these. I've already drafted out, roughly something. But, you know, there's a situation where we don't necessarily need to do it at the meeting, but at one of these in between trainings or get, working group or whatever, we could say, in January, we're gonna be talking about septic systems and we could address all of that and just come up with something that we think makes sense for this region and then bring it back to the board at the next meeting, talk about, because
I think it's really important.
Yeah.
Really.
We've had to ban installers, who have screwed up. You can't install for a year or 2 years, whatever it was. But once it's there, what do you do? That's a big problem.
So I have some ideas, we're pushing 10:30 now, and I know, you know.
and we do need to get to glyphosate regulations. I'm just saying that.
So real quick, this is a very long conversation to have. I'm more than willing to work with Jane, Butch, and others to set up a roundtable in the off season to pull in some engineers, installers, some of the stakeholders, and have a meeting. Tri-Town actually has installer regulations. We were the first to do it because we were the ones that created the septic installer program. But that's not the only problem. There's many other problems. I think what we need to do is, and Otis has some policies and procedures that I helped them craft years ago. It's not a regulation per se, but it's policies. But, you know, I'm running into a lot of problems too as well. And I think this is a Board of Health thing, not so much the governing board. We can facilitate conversation, but we don't set policy on behalf of the towns. If we may want to go down a path of a regulation, you know, at least a draft regulation, I'm probably going to do something at Tri-Town. It's been a while. The septic installer program has its own problems, in my opinion, that won't get solved today. But it's no different than a Title V inspector, Pat. These people sign up for a Title V inspector. They take one class, they take an exam, they're out there doing Title V inspections. It's a broader issue, and I wanted to revisit my own septic installer program because BCBOHA tends to do their own thing and not really tell the boards of health what they're doing. Same thing, they do a class, they get their certification, but like Butch and Jane, let's catch up in January after the holiday season. I'm more than willing to lead a broad meeting in person and Zoom to pull in all the stakeholders and have a conversation, say, look here's what we're thinking. We may pass a regulation and then start that conversation.
Does that sound good to everybody?
Yeah.
Okay. All right.
That would be great.
Yeah.
I mean, it's some issues solved.
Yeah.
I run into a lot of very similar issues as you when it comes to installations. There are too many holes, too many variables.
Yeah, well, I mean, anybody can go up there and take that class, but, you know, but when it comes time, like they'll send out a thing to do once a year thing. And you go up there to BCC and you sit there and it's like, it's more of a party hour than anything else. I mean, I've walked away there so many times and said, this is really kind of a waste of time. The only class I ever remember taking, because I took the Tri-Town one when it was Peter Kolodziej years ago. That was the greatest class going, because we went through everything, the math and everything. I went to one at BCC a few years back, and I don't mean to run over Jane, but, and it was all on conservation issues, but it was all things that involved, you know, septics and Board of Health things. That was an all-day class, and there was a test at the end, but it was a very informed, you know, it was great. You walked away with something that you could utilize, you know?
All right, so it sounds like we're gonna do that, have the roundtable discussion, and hopefully in the off season we can go into next year with some good. I'm hoping you'll be part of that.
Absolutely, I want to.
If you guys don't mind if we go over a little bit, Betsy's here, and the town of Mount Washington passed a glyphosate regulation, and I'm gonna let you talk about it.
We mirrored Great Barrington's. So I mean, since we have truncated time, I would like maybe everybody to take this and look at it and go over it and maybe have a discussion next time about it more.
And we'll give you a bigger spot. I'm so sorry that we ran
No,
out
that's,
of.
it's okay. Just with vaccine season and all that, I know things are tough, but, there's more and more information coming out about glyphosate, and there's like, if you read the articles in the newspapers and whatnot, there are multiple chemicals and multiple metals and things in our food now, and microplastics and all these things. And if we start with just our town roads and our town properties regulating that we don't allow it, or that you have to have licenses, different possibilities of things to do, that we can start the wider conversation of getting these chemicals out of our lives. The super wealthy in this country are all talking about moving to Europe because they don't have these toxins in their food. It's a fascinating thing, but Wellfleet has actually been able to, I haven't had time to go over everything Wellfleet's doing, but they've actually been able to get the legislator to say that their public lands can't be sprayed. So my hope is that if all the towns come together, at least starting here in Berkshire County, that we can then push a wider conversation into the state. And Ruby, I don't know if Ruby's still on or not.
No,
Okay.
maybe.
Anyway, so if everybody could sort of maybe do a little reading about this and look at this document, which mirrors Great Barrington's document, then we could have a better conversation next time when we have more time.
Other places have what's called, I think it's called the precautionary principle, where there has to be proof that it's not harmful before it goes on the market. The United States doesn't do that, right? They're more, ask forgiveness after enough people die. So, thank you, Betsy.
Yeah, thank you.
And maybe we should call it special topics. Like, the special topics, we could talk about septic as a special topic. Glyphosate as a special topic, and then any of the board members or public members that are interested could attend that special topic. And are you guys okay with it being at this time? Since all right, perfect. All right, that's all I've got.
Make a motion to adjourn at 10:33.
Second.
All right, any discussion?
Anybody dare say no?
All in favor? Thank you for coming.